So let's go to the audience questions. If you could just quickly introduce yourself and then ask away.
Great. Thank you so much. My name is Kevin Fitz. I'm the Executive Director of the Oregon Mental Health Consumer Association. And I think it was Dr. Shirtcliffe who said 1 out of 4 Oregonians approximately is on Medicaid. I'm a Medicaid recipient, particularly a high utilizer of behavioral health services, fortunately or unfortunately. Is there anybody else in the room who's a Oregon Health Plan or receiving Medicaid services currently? I see a show of hands. Anyway, just to illustrate my point to Dr. Kitzhaber, first let me just say I have respected you, your leadership, your innovation, your ability to be provocative for 30 years. I was hoping you were going to be President of the United States one day. This question is to you, but within earshot of Governor Brown's Chief Healthcare Aide and the Oregon Health Authority Director. If there are approximately 1 million Medicaid recipients in the state of Oregon, approximately 150,000 behavioral health, or maybe 100,000 people with severe mental health challenges using the Oregon Health Authority services. How can we do a better job? People like me who don't get big pharma or Centene money or anything like that, how can we do a better job of organizing our consumer folks and our peers in getting on the agenda, not just access, but having influence with people like Pat Allen and Tina Edlin? And I was telling you previously, under your administration, I met with Mark Gibson, who is an amazing, if you want it, you don't need to read Saul Alinsky, get to know Mark Gibson and his tactics of politics, just amazing. How can we, moving forward in 2018, how can we get some of that access and influence we had under your administration in the late 90s? I'll go sit. Thank you.
Well, I appreciate the question. I'm not the governor. We have a governor, Governor Brown, and I'm a little reticent to make suggestions to how that administration should provide access. I know that Tina worked in my administration. Tina was with me in Washington, D.C. when we scored the $1.9 billion. She is as knowledgeable as anybody in this state. Pat is new, I think, to the health policy piece of it, but had a remarkable run on the insurance side. So you've got a couple of really good people, and they both heard what you said. So I guess what I would suggest is that both Tina and Mr. Allen take it to heart and ask yourselves, how can we make ourselves and our agencies more accessible to people who really care about this, who have life experience being in the system, whether that's in the regular Medicaid system or in the behavioral aspect of that system, so that you can learn and be informed by the experiences that these folks have had. And so I'm going to punt it to Tina.
Thank you. I would add to that it's not just a matter of talking to me. I try to keep my schedule open to meet with people and have conversations. I'm sure Pat has that same policy. But I think that there's also, it's really important to work through the local CCOs as well, to be on their consumer advisory groups, to have a voice there, that even with strong direction from the governor's office, from Director Allen's office, how it plays out down in the community is also essentially as important. You know, we can get the big policy barriers out of the way, but how it plays out in the local community really requires that you're there as well.
Okay, next.